Hi, my name is Allan Frankel. I practice internal medicine in Santa Monica. I trained at UCLA and went into pretty standard internal medicine for nearly 27 years before feeling that my toolbox for treating patients for anxiety, pain, and many other illnesses was getting too small, and reaching for Xanax and Klonopin and Vicodin and other very addicting tranquilizers and pain medications became unbearable for me to write. And with prior experience actually in medical cannabis in the 70s at UCLA with the glaucoma studies and some cancer patients, I chose a career in cannabis medicine. I chose making a left turn in my internal medicine career nearly 8 years ago into cannabis medicine as I began to understand that cannabinoid medicine and the future of cannabinoid medicine would be a great replacement for many patients for benzodiazepines and pain medications, as well as the treatment of very many other illnesses. I was incredibly naive when I started, but over the last 7.5 years, we've all learned a lot, and medical cannabis now does fully integrate with the rest of my internal medicine practice, and for the most part I have been able to use alternative to benzodiazepines and narcotics, and the majority of my patients can get off of narcotics by the end of the year. The cannabis plant is something I'd like to talk about next. It's one of the funnier things that I've heard is that there actually are caves where they found fossilized drawings of bongs and pipes that are about 100,000 years old. 100,000 years ago is the beginning of the Neolithic age when man got control of fire. So pretty much when he got control of fire, they started lighting cannabis. If that's not entirely true, it's closely true. And regardless, cannabis has been used for tens of thousands of years by man, and there's very good evidence for that. Tinctures, extracts are well over 3,000 years old. Edibles, at least a couple thousand years old. But the cannabis plant made a real, call it a right turn in the last 150 years because cultivation started changing from expanded families to more formal cultivation as part of the industrialized age. And I think the needs for pain and anti-anxiety treatment became less important, and the appreciation of the THC and stony value became much more important. And over 100 years or so, the other very